defences that we have right now without a vaccine.
Government recently deployed 10,000 field workers to visit homes in villages, towns and cities in order to screen residents for COVID-19. M4Jam says it has a technological solution that can significantly accelerate data gathering, monitor the spread of the virus and allocate resources accordingly. Let's get more on this now from the tech company CEO, Georgie Midgley. Georgie, evening to you. Thank you so much for being with us. So what exactly are you proposing here?
Thank you very much for having me, Tembekile. So from our side, we just believe that mobile platforms and digital platforms like Money4Jam can help gather data that much faster and more accurately and provide real live data and dashboards to government and private sector to help them monitor this disease and help implement social distancing while doing it. So it is not to replace what the government measures have been put in place, but more to support it and help do that from the comfort of your own home and using your mobile device.
Let me ask you then, Georgie, how do you make sure that the information or the feedback from the app, let's put it that way in this case, is as accurate as possible, just given the level of worry and the seriousness of this crisis?
So from our platform's perspective, we built in a number of measures to make sure that the data that we collect is validated and moderated so that it can be used to make these the correct decisions. And I mean, rubbish data doesn't help anyone. So we've built in a number of AI platforms as well as integrating into Home Affairs so that we can try and collect the data as accurately as possible. And we do that through images, through training, as well as through dropping of pins to ensure that we are collecting only information per household.
One of the other questions becomes around the ease of use. The 10,000 field workers that government has sent out will be looking in particular at homes in rural areas, in townships where people may not have necessarily the latest smartphone, not as much access to cell phone data and the like. How accessible is this and how user-friendly, most importantly, is it?
So from our perspective, we find that cell phones generally isn't a problem. From our app is web-based as well as USSD-based, so you don't necessarily need to have a smartphone. It also works off a normal feature phone. From a data perspective, we've been working with the networks. We're currently zero-rated with Cell C, and a lot of the networks are open to zero-rating platforms like ours to enable people to collect this information at a zero cost.
You've also done, I see here, a survey within the informal market at the end of March. I think it was the 29th and the 30th of March, which allowed you to create real-time interactive heat map. Talk to us about why that is so important to have.
So these heat maps, particularly the ones that we do, is focused on your more outlying and rural areas. And that live real-time data can help private and public sector allocate resources more effectively. So firstly, there's a training element to it. So the respondents to those surveys, you can train them up on what to do and try and eliminate the whole fake news thing. We try and use only Department of Health information. We don't proclaim to be health experts. So therefore, we leverage all our information from the World Health Organization or the Department of Health. And then we try and share that with our respondents, or our jobbers as we call them, to make sure that they follow the right protocols. And then we like to share this information so that, like I say, private and public sector can make the right decisions and allocate their resources, whether it's testing kits, mobile units, or guiding people to the closest and nearest hospital and clinic, which we found, sadly, on average, 47% of people live more than 5 kilometers away from their closest hospital.
And quite interestingly, the people that you surveyed, the 1,000+ people that you surveyed, majority of them, over I think about 70%, preferred actually to test at home. Why do they prefer that to, say, going to a doctor's room or a hospital?
I think most of the information in the public domain is people are very scared of human interaction. So a lot of people would rather be tested at home so that they don't have to go into hospitals. I think at the moment there's a large fear around interacting with people, whether it's at a shopping centre or at a clinic or hospital. So the preference is 70% of our respondents would prefer to be tested at home.
And a lot of them still not knowing what to do should they be showing symptoms that are possibly linked to the coronavirus. Why are they not as familiar with the information that is needed, especially for someone like you who's basing a lot of your work on information from the World Health Organization and our health department?
For me, that was the saddest statistic that came out of the specific campaign, is that 30% didn't know what to do if they do show symptoms. And given the amount of information at the moment in the public domain, whether it's on billboards, TV and radio, that was quite a shock to us. When we did analyze it, we did find those particular respondents came from your much more rural areas. So they potentially not getting access to the information like we are in the urban areas.
Georgie Midgley, thank you so much for speaking to us tonight. Still ahead on eNCA, some communities in Mpumalanga